Today's case story of what the heck is wrong with our healthcare system comes from actually a new viewer, a new subscriber who sent me an email, which you can too, info@arkfeldchiropractic.com. And he relayed his, I'd just say it's a new story, but I've seen a common pattern here for the last couple of years. But let's delve into this story. So I'm not going to say his name, but the patient is one of these guys that works as a lineman. You know, when the power goes out, when everything goes out, they're out in all kind of weather and they're repairing everything. They're up doing dangerous job, yanking on this. And he hurt his shoulder, hurt his right shoulder on the job. He actually, it was called a labral tear, needs surgery. Goes and has surgery. Orthopedic doctor says, hey, it was a successful surgery. This is looking good. You now are facing 4 to 6 weeks of PT, which the patient said, not my patient, the ortho's patient, said, no problem. He goes through 6 weeks of physical therapy and he's due back in for a follow-up with the ortho. Goes back in and he says, you know what? I'm still having pain. I'm still having some restriction in my movement. I can't go back to work until I'm fully cleared. I have full range of motion and I have no pain. They won't let me back to work. At which time the ortho says, I think we need another round of PT. So he goes for another round of PT and not successful at all. So now we're down in, it's 8 weeks since he's had a surgery. He's thinking he's going to be back to work and he's not. And he's still not getting any answers. The physical therapist says, I don't know. I don't know why you're not feeling any better. You should be. And the orthopedic specialist says, we may need to do another MRI and may need to go in there and do an arthroscopic surgery to explain. He goes, man, I don't want to do this. I don't want to do this at all. And so this viewer is very frustrated. And again, he's still not back to work. He's frustrated. He doesn't know where to turn. So let me tell you, if he was in my area, if he came into my office today, this is what I would do. First thing, I would do a real thorough history. In other words, I would shut up and just let him tell a story because I want to hear his story. I want to know when he feels the discomfort or pain. What is he doing when he feels this discomfort and pain? I'd want to know what they did at physical therapy, what worked, what didn't work. And then I would conduct a real thorough neurological movement evaluation. Probably never heard of that because most of the time when we're dealing with orthopedic problems, you're going to get an orthopedic testing done. And that's typically what they do at physical therapy. And they base all their rehab on an orthopedic problem. And most of the time it works. But when it doesn't, that means it's not an ortho problem anymore. It's turned into a neurological problem. So I would tell him that. I would do my evaluation. I'd do the movement. I would do basic neurological tests. I would do another test called brain tap neural check to see how stressed he is, to see if he's in fight or flight, to see if he is getting proper sleep, to see if his brain has a lot of inflammation. So you can't be in pain, and you can't be stressed about not going back to work and think that you're going to be sleeping well or think that part of your nervous system isn't going to be functioning well. By the way, that part of the nervous system is called the autonomic nervous system. So I would imagine he's probably in what we call sympathetic dominance. When you are out in the woods, you come across a bear. I know most of you guys in the city wouldn't have this happen, but let's say you just about had a car accident and you're just going, heart rate's up and everything. And then you got to calm down. That's that part. Nobody's looking at that. We would do a movement analysis and see how well he's moving. Overall body movement analysis, just not on his shoulder. We're just not shoulder movements. We would do neck, the full body. We'd use our neck care system. If you're not sure what that is, Google it. We'd use our kinetisense, Google it. And then again, we'd use brain tap neural check. Okay, so then I would sit down and I would tell him this because I'd be very confident that I could tell him this. I would say, you are not going to have to live this way. And I would throw the F bomb at him. No, not that F bomb. That we're going to fix bomb. We can get this thing fixed from a neurological rehabilitation standpoint. So, what would I do? Being a chiropractor, I believe that we need to do very gentle mobilization or manipulations on the cervical spine and on the shoulder because we've got to get those joints talking to the brain. We've got to get the muscle. See, this is where it's really important. We would use a device called NewFit. It's from Newbie. And we would do a mapping because there's muscles in there that have not come back to life. They have not been turned on. There is a dysfunction in those movements. And it's brought about by a muscle that is just because he's been laid up. And PT exercises cannot do this. You've got to get down and activate this. It's like his muscles are in bad cell coverage, and we got to get him back. We would scan the muscles and see which one or which ones are just dysfunctional. That's where we put the pads in. We have him do movement therapy, and we increase the intensity. I would follow that up by Normatec compression as our cool down, and then we would do our brain tap entrainment therapy. So the brain tap I talked about before was the diagnosis part. Now we're going to do the treatment, which are a headset, and he would listen. He would go to the beach. He would go to the mountaintop retreat. He would get out of that fight or flight. Most of our patients fall asleep, and it's always at the end of the care. And so we're taking on every single aspect of a neurological condition. We've got the joints that we're firing. We got the muscles we're firing. That's called the peripheral nervous system. They are sending signals up to the brain. That's called the central nervous system. And the brain needs to know this. See, nobody recalibrated the brain after the surgery or during the PT because they don't have the tools to do that. And then we took care of his autonomic nervous system. So he's getting sleep at night and he's getting well rested. And then I would also have prescribed him another electrical stimulation unit, and it's called BioWave. BioWave is going to be our pain management. So you put BioWave on, and it would go and block the pain transmissions. And he can use this for the rest of his life on any area that's causing pain. It wouldn't be just for his shoulder. Unbelievable value. And oh, by the way, there's a 30-day money guarantee on this. Look it up. It'll be in the link. So I highly recommend that. That's what I would do. And we'd get him back to work as soon as possible. He would have full functional movement. He'd be strong, and he'd be enjoying his life again. There wouldn't be, I don't know what's going on, or, oh, let's maybe do this. There'd be no guesswork. We take the guesswork out of it. I always say many times at the beginning of an interaction with the patient, the first visit, and what I say is more important than what I do, because that's going to start the therapeutic intervention. I just gave him hope when I tossed out, we're going to get this fixed. And you know why I can say that? Because I've seen it happen so many times. Got in contact with me at info@archfeldchiropractic.com. I want you to comment. More importantly, I want you to subscribe. This Defeating Pain podcast, this YouTube channel is for you, where you get to voice your concerns, your frustrations, and get heard. And then I can give you some solutions, hopefully, and maybe hook you up with somebody in your city or town that can restore your function and get your life back. So until the next time, hey, let's keep defeating pain together.